Good morning, everyone. Let me begin by saying what a privilege it is for me to be a participant in this wonderful forum. The topic that I'll be speaking on today is indeed healthy brain aging. And I think that the fact that we get to discuss a topic like this in a forum situation is a testament to our clinic's dedication not only to research and to explore opportunities to help people who are experiencing cognitive impairment, but also to be advocates in terms of lifestyle choices and other interventions that can be done early on and hopefully lead to prevention of cognitive impairment. I have the benefit of speaking at a very high level in terms of touching base with regards to strategies to help with healthy brain aging, because I know that shortly upcoming, the other speakers who will be presenting this morning will go into the wonderful details in terms of the research and some of the other interventions that are going to be helpful. But I am looking forward to giving you this brief overview in the time that we have and hopefully having some discussion during the question and answer period. So one of the things that struck me early on in preparing for this talk is how much information is out there. After all, the whole idea of promoting youth and preventing aging is a multi-billion-dollar industry. And whenever there's that much money at stake, you know that there's going to be information out there, whether it's on the internet, on the radio, in the newspapers. And part of the job that we have is really distinguishing between what's good information and what is perhaps, well, kindly put, less than good information. And this is where Dr. Robillard is going to really connect with us in terms of looking at reputable sites for brain health information. And I think that's key in this day and age, really to be able to access that information. And in particular, what we know is that a large focus of this sort of anti-aging movement is really to look at strategies behind how we can improve our memories, to stave off dementia, improve focus. And this is really the question, how much of this is actually science fact versus science fiction? So what I'm going to do is actually focus in on the areas that we currently have the most evidence to support. Now, this is very important to emphasize. As researchers, we know that just because there's not a clear answer doesn't mean that there's not truth to the fact that there can be other benefits that are obtained with certain therapies. But what we're going to do is focus in on the areas that we have the most evidence to support and the ones that we can feel confident in recommending to us now. One of the things that I want to start off with just sort of clarifying is the idea of pursuing the fountain of youth. Of course, it's a nice idea to think that a magic elixir exists that's going to prevent aging and to halt any of the detrimental associated processes that happen with aging. But I think that we should really turn around that attitude. Aging itself is not a disease. It's not something to be prevented. Rather, we can think about this. How many of us know individuals who are perhaps older but are very cognitively sharp? How many of us know individuals who continue to do what they need to do every day without any limitations despite their age? Really what our focus should be is looking at those individuals and identifying what is it about them that has caused them to age healthy? What sort of lessons can we learn from them in order to incorporate in our own lives? Another important clarification, though, is to also say at the same time, healthy brain aging is not to say that there aren't any changes that happen in the brain with aging. I think that would be a little bit naive. We do know that with aging, there can be subjective changes with how we may recall information, may learn information as quickly as we once did. But having said that, in the same breath, I should mention that studies have been done that show that as we get older, our vocabulary can sometimes actually improve, and our general fund of knowledge, our wisdom actually improves as well. So there's a lot of adage to that with age comes wisdom idea. So the point is that we're not looking for the complete absence of any cognitive change, but moreover, the absence of cognitive change to the point where it impacts our ability to do the important things that we need to do. And that certainly is achievable. We know that people are able to do that. But the question is, how do we achieve that? And what can we do to help ourselves increase our likelihood that we'll be in that category? Now, earlier on, just in the last talk, you heard Emily refer to this analogy of the jar with the stones. Well, I have a different analogy to share with you that's sort of a similar nature, just slightly different. If you think about our brain function as your bank account, who doesn't like a big bank balance, right? We want as much money in that bank as we can, making deposits all the time, building up that bank balance. But when these stones get put into our jar that sort of are these withdrawals from our bank account, The more money we have in our bank account, the more prepared we'll be to deal with these little withdrawals that are happening. And of course, we should also make efforts to try, where possible, to avoid the things that would withdraw from that bank account, whether that is head injuries or other reversible factors that we have some control over. So what we need to do is then explore what can we do proactively before there's a memory problem in order to build up that bank account and reduce those withdrawals. One of the areas that you're going to hear more attention about is vascular risk. And by vascular, I'm referring to blood flow. And to quote what Dr. Wellington will be talking about later, what's good for the heart is generally good for the brain. So if we think about vascular risk factors, these are the traditional things like high blood pressure, high cholesterol, diabetes, smoking. The more that we can do, and I would offer to you, the earlier that we can intervene, the better. Now, of course, that's not to say that evidence doesn't exist, to say that even when cognitive problems are present, even when dementia is present, it's still very important to control these factors. But wouldn't it be nice to think that if we could intervene years, if not decades, before this is a problem and have impact downstream, shouldn't we be doing that? I would say yes. Physical activity is something that often people look at us incredulously. And when we say, you know what, to treat your memory, to prevent memory problems, you should exercise more. Well, Dr. Louis Ambrose is going to expand upon that whole idea, not only about treating Alzheimer's disease and other forms of dementia, but also in prevention. So I won't spend a lot of time talking about it because I know you're going to hear from the expert in this area. But just to say, this is something we're finding ourselves more and more frequently encouraging people to do. What about nutritional interventions? Well, the thing is that, unfortunately, this is where you probably are going to encounter the most information out there and the most questions in terms of what's true, what's not. The general rule that I would apply, and certainly what I propose to our patients that we see, is that there's no one magic pill, there's no one food or supplement that above all else will be guaranteed to prevent cognitive impairment. Now, that doesn't mean that research isn't ongoing in this field. It certainly is. But the value in terms of nutrition really seems to be primarily if you take this as a whole nutritional approach to diet. So rather than thinking that if eating blueberries is a good idea, that you should be only eating blueberries, it's a matter of incorporating that in an overall picture of how you approach your diet. And this is borne out in a lot of the research, for instance, into things like the Mediterranean diet, which is a whole approach, which you would moderate alcohol, fresh fruits, vegetables, some grains, and it's all about balance. And I think the important message that I would say at this point in time is the more that we can do to watch our diet and eat healthy in an overall sense, the better. And of course, with research coming in, there may be times when certain supplements can be something we would recommend more highly. But at this point in time, there's no one particular thing that we say, well, you know, everybody should run out and go buy right now. What about pumping up the brain? This is really the analogy about making those deposits into your brain account. And ultimately, the message is, again, sort of like with diet, there's no one activity that everybody has to absolutely do. It's a matter of finding what fits for your circumstance. Find something that's encouraging, engaging, interesting, challenging, but not frustrating. But also, think about this in the context of variety. Whether it's music, whether it's socialization, whether it's puzzles, take on a variety of different activities. And I think taking this approach and looking at this as making deposits into your brain account is a really important way to conceptualize the fact that we're making brain connections, we're building pathways that will hopefully help prepare our brain for compensating for some of those withdrawals that happen when little bits of damage or other things happen to the brain. And I know that I've said, you know, earlier the better, the earlier the better. Well, the other message is it's never too late. In this one particular study that looked at roughly about 100 people who were ages 20 to 30, 100 people over the age of 60, they looked at an intervention which was 100 days, an hour each day of training with 2 areas of memory and processing speed. And what they found was that not only did people improve in the areas that they were being trained on, this also translated into improvements in other areas of testing that was done as well. So suggesting that there's positive transfer of stimulating the brain into other areas. So again, quite stimulating information that would suggest to us that the more we do to challenge our brain, the better, and that it's also never too late to start if you haven't already. Now, so far we've been talking about things in isolation. We've been saying, well, nutrition, exercise, mentally stimulating activities. But what if we do it all at the same time? Well, this study, known as the Finger Study, was published out of Finland, and they looked at various sites within the country. They looked at over 1,200 individuals and randomized them to either receive a very intensive program run by a physiotherapist, a psychologist, and a nutritionist. It was a 2-year program where they attended to these things like exercise, diet, and mental activities. And they found that in the overall cognitive testing that they did, there was about a 25% improvement in the intervention group compared to what they call the control group, the people who didn't receive the intensive therapy. The improvements were primarily seen in areas of what we call executive function. So these are high levels of brain activity and also processing speed. And if you also know that what we said earlier was that the speed at which we process information sort of slows with aging a little bit. So these are areas which can actually improve with the right intervention. There was also improvements that were beneficial in terms of a person's overall health and well-being. Their body mass index, their dietary habits, and their level of activity improved even after the study was ceased. So these are all very important messages to say that there can be a role to play in terms of intervention for people, even despite the fact that they're older. And I will say in this particular study, they specifically chose people that were felt to be at risk for dementia. So this wasn't just your average older population. These were people who had potential risks for memory problems. So to sum up, what we've heard is prevention is better than cure. And this person here is sidling up to the pharmacist asking for some prevention. But I think the message that I would also share with you is it's never too late to start. So please know that if we can leave here today with reaffirmation of the good efforts that you make in terms of your lifestyle, these will pay off. And it doesn't matter how old you are, there are benefits to that. A multi-pronged approach is what I would certainly support. I think that it's nice to think about the fountain of youth being out there somewhere where it's a matter of just taking that one pill or drinking that one elixir that's going to cure all of life's ills. But the truth is, it probably takes a bit of work. But of course, if I were to ask the question, I'm sure you'd answer, you're worth it, aren't you? So to put in that efforts, I think, is something that I would certainly encourage. The fountain of youth may be out there, but I think rather than thinking of the fountain of youth, we should think about the fountain of being happy with how old we are, but realizing that we should all take the opportunity to make the most of that, regardless of your age. We should do these activities. We should be engaged in being positive about what we can do that may have a positive impact in terms of our future cognitive health and well-being. So I would like to end there in the interest of time, but I do look forward to your questions and your comments, and I thank you very much for your attention.